And then there's a third way.
ZIFT is where if you're not 100% sure that those sperm and eggs are going to get together, you do the in vitro fertilization first. But instead of putting them in the uterus, you put them in the fallopian tube, because that's a more natural environment. That's where nature normally accomplishes fertilization. And again, the pregnancy rate is about 50 to 60% per attempt if you use the ZIFT.
But it's always using the husband and the wife's sperm and egg, or do you ever have to go away if I say the husband doesn't have sperm, so we'll get somebody else?
If the husband has, really, most of the time the husband might, if the husband has a problem, he'll have a very low count. And despite really minute quantities of sperm, with this technique you can fertilize her eggs, because you don't need much sperm. But if he has zero sperm, well, they might be willing to have donor sperm used.
So why, all these people that applaud her, why aren't they doing this? Why isn't everybody doing this? Why are they waiting 10 years and blowing the tubes out and doing all this other stuff when these three things are so...
Well, because as recently as 5 years ago, these three things weren't so good. They were too complex, the technology hadn't been worked out, the culture media had toxic ingredients in it, things weren't worked out that well. So it was a last resort, last-ditch effort. And we really didn't have good treatment 5 years ago for infertility. But in the last several years, this technology has gotten so good, the pregnancy rate so high that almost anybody can get pregnant, and we should push these techniques earlier. Right away, rather than waiting after time has run out.
I mean, if you want something, you should do it.
Why wait, right.
How much does this cost?
Well, generally it'll be anywhere from $5,000 to $8,000 per cycle. It is
cycle?
Per cycle.
So each try?
Each try, if it takes an average of 3 tries for the average couple to be pregnant, that could add up to $24,000.
Yeah. So that's what, and insurance doesn't or does pay for this?
Well, insurance pays for most of the treatments that have been done in the past for infertility. Ironically, if you ask insurance companies, they'll say, well, we don't pay for this new technology, it's experimental. But it isn't experimental, and if the doctors and the clinics handle the insurance companies properly, often we can get them to pay.
And a woman could be any age, you told me, because I was thinking of doing it.
Any age.
Any age. No. Even after menopause, right?
Well, after menopause.
Not that it has to apply to me.
You're right.
But if I have a friend, I'm asking for a friend.
For a friend.
I have a friend that wants to know.
Well, for any friend over 30 or over 50.
God bless you, doctor.
At any age, really, can get pregnant with this.
Tease. Is there any pain at all involved?
Well, you know, there is a little bit of pain. There's no medical treatment, even getting your blood drawn, but it is relatively painless compared to all of the other routine treatments that most of these couples have gone through for many years already.
But what I want to say now is, because I don't know, I think anyone that has a child out there, the best thing in the world is to have a child. I mean, my high point in my life was and still is Melissa. So we were thinking, what could we do? Because, you know, we've given away silly things, plastic surgery, we've given, you know, dates and stuff. I was thinking, if there are two couples out there, what I would like to do, if there are two couples out there, we have asked Dr. Silber to answer all your, well, I want all of you, let me start this way. I want all of you, if you have any questions on infertility, please write in. Dr. Silber will be kind enough to answer your questions personally on the air for the next couple of weeks, about 8. Send us a video cassette also, introducing yourself and telling us what are your problems and what you would like to know. And please be specific as possible, because the more the doctor knows about you, the better he can answer your infertility questions. And then make sure you include your name and your address and your phone number on your tape, because Dr. Silber may want to review all the cassettes. And then we decided he would meet with several couples, this is so nice of you, doctor, to discuss their medical histories and the methods that might be best for them. And then, which is so great, I mean, I don't think anybody's ever done this before, he is going to not choose, but I guess find the two most logical couples, and you're going to give them the treatment free.
We'll give them the treatment free,
and
right.
maybe, wouldn't that be nice to give them 2 babies? What's your name? Your first name?
Sherman.
Sherman. So Sherman could be if it's a boy and Joan if it's a girl. That would be that's the only catch.
Well, Joan might work. There are thousands of couples have told me they were going to name their child Sherman, and no one has ever done it.
Well, if there are people out there that wanted to speak to the doctor, and maybe, you're not chosen, it's not a contest, but maybe one of the 2 couples that we will help, please send your cassettes to the GIFT of Life, the Joan Rivers Show, 524 West 57th Street, New York, 10019. Okay, and the weeks to come, you'll come back and we'll look at things on video and help us find out why you're selecting the two couples you're selecting.
Exactly.
And then
I'll
if
be
they got
delighted.
pregnant, wouldn't that be great? And then we could have the birth on the show. That'd be so great. Thank you so much. Thank you very much. We'll be right back with In Living Colors, Tommy Davidson.